Hi everyone, I'm back. So I promised last time that we will be talking about the ECG, but then I changed my mind. Instead, we will be talking about coronary circulation. Coronary circulation is actually the blood supply to the heart muscle. And we all know that the heart muscle comprises electrical and contractile cells. So we have to find out what are these arteries that supply the heart muscle. We call them the coronary arteries in here. So there are two hearts in here, but I chose this one because I have some names already of the arteries. So these are called coronary arteries in here. We have the one on the right, and we have one on the left. Okay, so the one on the right is this one. The one on the left is this one, but it divides into two branches. Okay, and they are located at the base. The opening of these arteries, the right coronary artery and this one, is actually located at the base of the aorta. Okay, and it goes down. And there are some branches, and the branch of this right coronary artery is blue. It goes at the back of the heart. And that connects with the posterior descending artery. This one is here. And this one is the long one here. The blue one lying down. And then further down, there are the distal branches. And the left coronary artery is here. It divides into two. The left anterior descending artery and the circumflex. Okay. There's their name and everything. Left anterior descending artery and the circumflex. They have branches. We have the diagonal branches for the left anterior descending. And this one, this heart doesn't have, but this one, you'll be surprised, has one. So we have this, just marginals. For the right coronary artery, we have also this acute marginal. So these are the arteries. So you're wondering, these arteries, these coronary arteries, actually starts from outside of the heart. So externally they are out. And then as they go deeper to the heart muscle, they become smaller and smaller until they become capillaries, so that they will be able to reach all the parts of the heart. So during systole, the heart pumps out blood from the left ventricle. So other organs of the body will get the blood supply. But the heart muscle gets its blood supply during diastole. So during diastole, there are two diastole here that is actually involved. So two diastole is involved when the heart muscle gets its circulation. During aortic diastole, when the aortic valve closes, and during the left ventricle diastole, when the ventricle relaxes. That is the feeling time. So aortic valve opens, aortic valve closes. That's aortic diastole. Mitral valve opens. That is left ventricular systole. It's feeling time for the left ventricle, but it's relaxation time. Okay. So how will we start our circulation here? If we start the circulation, the aortic valve closes. Now the coronary artery, the right coronary artery, collects blood from the aortic base or the aortic root. So with the left coronary artery in here, this is the left main that divides into left anterior descending artery into the circumflex. So with the right coronary artery and the left coronary artery, that is left main, the left anterior descending, and the circumflex. Okay, back to the circulation again. So blood is collected from the aortic base by the right coronary artery. Okay, and the left coronary artery collects blood and delivers to their branches, into the branches and everything. So what does right coronary artery supply? What does it supply? It supplies the right atrium and the right ventricle. Okay. And if you look upward, the right coronary artery has already a branch that goes to the SA node. So this artery in here, SA node artery, supplies the SA node with blood. So as the right coronary artery goes downward, and at the back of the heart, there is the AV node. So this AV node, I put a circle. There is the AV node here. That's the AV node. And that is the SA node. So they get the blood supply, both of them, from the right coronary artery. Okay? And the right coronary artery supplies a little bit to the left ventricle at the back. So how about this left side here? So we know that the left main divides into two branches, the left anterior descending artery and the circumflex. The left anterior descending artery mainly supports or gives blood or supplies blood to the anterior part of the left ventricle. So the LAD, the left anterior, the LAD and the circ actually are the arteries that wholly supply blood to the left ventricle. So left anterior descending artery supplies blood to the anterior part of the heart, and the circ supplies blood mainly to the lateral part of the left ventricle. So we're talking about left ventricle. And this left anterior descending artery supplies the septum and the right bundle branch as well. Okay, that's it. And going to the back as well, it wraps around the branches, it wraps around at the back. So this is the one for the circumflex, because I use two heart in here. Okay, for pinpointing where these arteries are. So what is the significance of having the diastole during coronary circulation? Well, as I said, during aortic diastole, the aortic valve is closed, blood is collected by these coronary arteries in here. So I call it the pickup time. So aortic diastole is the pickup time. And now they're gonna go to the heart muscle. There's another diastole involved here. And that is the left ventricular diastole when the heart muscle is relaxed. Because when the heart is contracting and squeezing, these arteries will be squeezed, and they will not be able to supply blood to the other parts of the heart muscle. So during the relaxation of the left ventricle, that's when these arteries continue to support the other parts of the heart with blood. These things are not going to work during contraction. So they waited till there's a relaxation of the left ventricle, and they wait till also aortic diastole. So aortic diastole, aortic valve closes, left ventricular diastole, that is when it relaxes. That is the time of coronary circulation or perfusion. That's it. So we discussed that one. Now let's take a look at a normal coronary artery here. This is the cross section of an artery in here. If you look at it, it's clean. You see that? It is an open artery, so it's clean. So if I run fast, I got good blood supply. If I rest, it's no problem. Look at this. This is a second artery that has already a plaque. Not much, but it's still a plaque. So if I run fast, I feel some discomfort. If I rest, I'm fine. So the basal supply blood is okay. But when you exert an effort, you need more blood supply to support your heart muscle, then there's a problem. You feel some discomfort. The third one, the third cross-section in here, we see that the plaque is getting bigger. So this one is a hill of plaque. This is a volcano of plaque already. And look. So if we get a bigger plaque in here, the tendency is the blood is flowing inside and it cracks this plaque inside. When there's a crack, we all know that these plaques are also supported by blood supply. So it creates bleeding, capillary bleeding there. The platelets are very smart. Well, that's their job. They have to put a plug in here. So more and more platelets will go and cover it to avoid bleeding. And here comes the fibrin or the clot. So they thought they're doing a good job, but for the person or the patient, it's bad because now they close totally the artery, the patient will have a heart attack. If just chest pain, severe, you still make it, 911 can go to the cath lab and they look into the heart. If the patient cardiac arrest, we get a problem here. So the ECLS should be fast enough and they will resuscitate the patient. But still they have to go to the cath lab and look inside. And they will